What do you think it takes to build an environment where this works?
Every CMH has a board of directors, so from the board of directors all the way down the level, how families are greeted when they first enter the agency. You have to create a very inviting atmosphere. You're coming to a community mental health agency in much pain.
Right.
I mean, whoever walks in there is in pain. Right. So what's the environment like?
Is it possible to change people's attitudes?
That's an incredibly difficult question because I'm not sure how you would do.
Okay.
I think there are some people, yeah, I think there are, unfortunately, some who are just unable to do it. Yeah, unable to do it. And I think the work for them, you have to kind of channel or shift their work to maybe not be so involved with that population.
Because there just may be that you have to face the fact that it's just going to, this is the way it is.
Yeah.
And
I think it is an attitude, and I'm not sure you can build in the skill, because it really is about your approach and how you came into this field.
Do you want to add anything to that, Kim, before I talk a little bit about this manual?
I agree with Kiri. I think on both the professional and the family side, I think that there's something that's within all of us, whether we're going to accept this and work on developing our partnership or it just isn't there. And it goes that way for both sides, because sometimes families have gone through so much, so their crisis has been so huge that it is not easy for us to, put those things down and those feelings down to be able to work with our partners and to partner the way that we want to. So I think it definitely is something that's within us.
That's a good point to make. It does work both ways. Sometimes it just can't be for parents also, for whatever reason. And so thank you. Thanks, both of you, for your comments about that. I want to talk to you just a minute about a manual that was developed 10 years ago, but I still believe the contents of it are pertinent for today. First of all, the family spoke about what they were most afraid of in developing partnerships with professionals. And this is what they said. They responded with these statements. I'm afraid of losing custody of my child if I make too much trouble. And they saw being a partner as a potential looking like a troublemaker. I'm afraid my child's providers will be angry with me for speaking out and reject us. They actually thought they might lose services. I am angry about being exploited, showcased every time the program goes after another grant. After they get money, we never hear from them, and I'm afraid that won't change. I'm afraid family voice won't make a difference, and we've been asked to speak for a cause without enough information, and we're told what to say. I'm afraid of feeling like a failure when I speak out for other parents, because I cannot make things different. I'm afraid of being blamed for my child's problems. So those were kind of like the top 5. Very powerful statements.
Very powerful statements.
And now I want to tell you what changed my life was what the professional said. I could have probably said any one of these myself at some point in time in my life as a family member. But I don't believe I had ever been in a place where anybody had asked a professional why they were so frightened to partner with parents, because it was real true fear. So let me tell you the kind of top 5 things that they said. I'm afraid I'll have to answer to my boss for a decision I didn't make. I'm afraid of losing my professional identity, status, and ownership of the expertise. I'm afraid no one will want the treatment I'm so proud to offer. If partnering with families doesn't work, I'll be seen as incompetent and a traitor to my profession for trying.
Really?
And we've come a ways in 10 years since then.
Yes, thank God.
We have come a ways since then, but not everywhere, let me tell you.
Okay. Yeah.
Okay, another one, things are changing so fast, I'm afraid I can't keep up. When families want so much so quickly, I'm afraid of not being able to deliver and being helpless and incompetent.
Yeah, I can see that very
Yes.
much.
I'm afraid a family will hurt their child, and I'll be blamed for trying to collaborate with them. And the last one is, I feel families only see us as our roles and not fellow human beings. And I do believe the work that's being done in partnership changes that.
Yes.
I think we do see each other.
In the comments by the professionals, several of them, it was clear it really had to do with their wanting to be able to provide the best services, the best, interventions they could for families. Some were, more defensive, but I don't know how many out of the 10, but several of them really talked about being able to provide the best service.
Well, ladies, thank you. I so appreciate it. Kim, any other words of wisdom from you at this point? Would you like to add anything here as we wrap up?
I think sometimes we look for role models, and we look for someone to kind of follow in those footsteps. And so I believe in our area in Wayne County, we kind of hit both sides with our partnership. With Kiri being so much of a supporter for Family Voice, it helps. And for us at ACMH, it helps for parents to see us as advocates develop that partnership with Kiri, with our local community mental health, and for them to see that we trust each other is a beginning spot for us to kind of move forward, because I think a lot of times they look at those things to see if this is worth believing in, and this is worth chasing the dream of us being true partners.
Right. I would agree.
And it's fun.
It is fun.
Yeah, I mean,
We're all fun.
Yeah,
Yes.
I mean, partnering can be fun. You get to know each other in a different way, and I think it expands the experience for families, and expands the experience for professionals, and you can enjoy each other.
Thank you.
Thank you.
Thank you.
Thank you.
I'd also like to thank Amy Winans for her commitment to this. Amy's the director of the Association for Children's Mental Health in Lansing, Michigan. And I'd like to say thank you, Amy, and for your commitment, and also to the Detroit people for coming in and doing this with us today. And hopefully they can be a role model for other partnerships in the state of Michigan. Thank you.